I work for a company called Verily. Has anybody heard of Verily? Wait, hang on. Let me just make it so I can see you guys all. I feel like I need to go into grid mode. Okay, here we go. Oh, I can only see a few of you. But so most people haven't heard of this company called Verily, which is the company I work for. But most people have heard. How many of you guys have heard of the company Google? Okay, that's
Not
everybody,
me.
right? You pretty much have to be not existing on this planet if you haven't heard of Google, right? So Google is a big technology company that actually is if you look at its real name is actually, the corporate name is called Alphabet. And Alphabet is a whole bunch of different companies. Google is one of them. Google is the biggest one. But there are other companies like YouTube, Waymo, that does like a lot of like maps kind of thing. They have a whole bunch of different companies in Alphabet, in this Alphabet family, and we're one of the Alphabet families, so family companies. So Verily is Alphabet's company that was purpose-built for healthcare and biomedical kinds of products. And I'm a physician, I'm a doctor, and I joined Verily about 2 years ago. My whole life I've been working in universities and in medical centers, and most recently I was the CEO of a hospital system. But then I decided to move to technology. And so here's a layout of the overall. So you've got Alphabet at the top, you've got Google and all different kinds of companies within Google, and then Verily is just for healthcare. And then if you maybe go to the next slide for me, Misha. Okay, so I'm going to talk a little bit about how we think about, you've heard a little bit about vaccines, and now what I'm going to talk about really is how do we help prevent the spread of COVID? And how do we use data and technology to do that? And the specific example I'm going to be focusing on is actually college campuses. So I know none of you are going to college just yet, but hopefully many of you are hoping to go to college. Isha is in college now at a really great place. And all of these colleges are thinking about how do we manage in a COVID environment? How do we get students and professors back to campus? And it's kind of the same problem you guys are all probably thinking about for your schools. How do we get middle school back? How do we get elementary school or high schools back? It's the same question. We have to try to keep COVID from spreading. So I found this website. Paul Romer is a really famous economist. He won one of the largest, most prestigious prizes that are given to economists. He happens to be at NYU, which is where I'm right now video conferencing you from. And he has on his website, which I've put the link here, paulromer.net, some really nice, what I think are nice simulations, which are basically examples of how COVID infection spreads and how we as scientists try to think about it, because it's a way of us figuring out how can we try to reduce the spread. So this is a model, and I'm going to ask Isha in a second to click on it, but if you see this little box to the right, you see all these triangles and then a few red dots. If you see those, so the blue triangles are just people who are healthy and who do not have COVID virus, okay? The red circles are supposed to be the people who have the virus. So they're infectious, they can spread it to other people. So when red dots bounce into blue triangles, the blue triangles can get infected and they'll turn into red circles. Does that make sense? And then eventually you'll see after the red circle is sick for a while, because the red circles are the people who have COVID, they'll turn into purple squares. And the purple squares are the people who have now recovered. And we really hope, although we're not 100% sure, but we really hope that they now won't get COVID again. So we hope that they're more likely than not, they won't get COVID again. So the purple squares will just stay purple the whole time. So what Paul Romer did here is he did a simulation and just used computers to just have these dots randomly move around. And we're going to look at, go ahead and click it. We're going to go around and see what happens when we start with 5. Whoops.
Is there a specific, or do I just keep
Oh,
scrolling? Okay.
oh yeah, you can play it here. Sorry, I think it might have gotten lost. The link might have gotten lost when I sent it. Yeah, just click that one. So you see, we start with 5 red dots, and then now every time they bump into a green or blue triangle, you see how they start to get infected, and then some of them recover and they turn into purple squares. And basically, if everybody just goes around living their lives, not wearing any masks, not social distancing, just hanging around with people like we did maybe in February and in early March, then eventually what happens? Everybody turns into red dots, and then eventually everybody turns into a purple square. Do you guys kind of see this? You kind of get the sense of what's happening here? And eventually what happens is everybody will get infected because you're not doing it. Now scroll down. If you scroll down a little bit, since we're on this, I'm not sure what's happening with my slides. This shows you, this curve is just showing you in the black line just how eventually you start off on the left side of this curve with nobody's infected, and the black line just goes up and up and up because just more and more people get infected. And then if we go to, let's see if we can look at the next video, because the next video I'm going to show you is what happens when people go to the next post. Yeah, that's perfect. And then scroll down, and there's 2 videos at the bottom, and I would like you to do the one that is isolating based on test results. Okay, before you click, hang on one second. So we're just going to do one little thing that's different here. And what's going to be different here is now we're going to start testing people for COVID. Okay, so in the beginning we just let everybody run around or whatever, but now we're going to say, you know what, we want to start testing people for COVID, because if we can figure out that you have COVID, because a lot of people who have COVID don't have symptoms. Do you guys know that already? Have you guys talked about that? That maybe as many as half of all people who have COVID may not actually feel that sick, but they can transmit it to other people. And we're actually, frankly, that happens even more often in young people. It happens more in kids and even in college-age students. So the older teachers and professors are worried because they don't want to get COVID from people who think that they're healthy and just walking around. So that's why we want to test people. And in this simulation, what's going to happen is people who test positive, they get an orange box put around them. And that orange box is kind of basically means that we would either quarantine you, we'd say, okay, stay at home for a few days, please don't go out and infect anybody, or stay in a special dorm, for example, where you're isolated from everybody else. Okay, so if you click this, you'll see what happens if we start testing people and quarantining them. What happens to our ability to contain the pandemic? So do you see how, like, compared to the previous one where the red dots were just going all over the place, in this case, you'll see some clusters break out, and we could play it again if you want to see it again. But by quarantining everybody, those clusters just kind of eventually, they just turn into a few purple boxes, but then the rest of the blue triangles can just happily go around and they're not infected. And then after a while, see, there's no red ones anymore now, because we've actually, everybody who got sick or got infected, we isolated them from everyone else. And now there's no COVID to spread to anybody. Do you guys see how that works? Do you get the general idea? I feel, hey, okay, let me just put you on grid again. I feel like I need a little bit of people nodding up and down. Okay, nod if you understand. Okay, if you don't understand, raise your hand and we can play the video again. Does anybody want me to play the video? Want us each to play the video again? Do you get the general idea here?
Can you play the video below it? I think you said that there's 2 videos.
Well, there's 2 videos. The one below it is a little bit more complicated. So if you want to go and read about it, you can read about it, but it just shows another different situation of if you just randomly quarantine people, which is probably most people aren't going to do right now. So this is really the video that's the most sense, because you test people and when they're positive, you quarantine them.
Yeah,
but if you want to, you can look at it yourself. Yeah.
Yeah, I can send the link in the chat, Eric, if you would like to look at it.
And then you can read more of the details about it, because I'm kind of rushing through some of the details. But I think it's really cool because it's the first time I've actually seen where you can actually just see what actually happens with this. And it's random. So if you run it again, the clusters might show up in different places. It's not like a video where you're just seeing the same video over and over again. It's actually, you know, it's doing a random simulation, which is pretty neat. Okay, so now if we go back maybe to the slides, what I was trying to explain on that part is just how important it is to do testing, because once you start testing people, you can isolate people. So if we go to the next slide, and maybe the one after that, let me see. Okay, and the one after that. Oh, see, now they're playing. Okay, so this is the slide that just is supposed to compare. On the right, the graph is showing you how many people are getting infected in that black line, and over time. So this is a graph that's showing you over time, the black line goes up because more people get infected, and then about 20% of everybody at any given time is going to be infected, which is a lot of people. Okay, 1/5 of people infected, that's bad. And on the left, if you actually do testing and then you isolate people, you can keep it down so very few people are ever really infected, because that black line is so much lower than on the right. Okay, if you go to the next slide. So now I'm going to tell you a little bit about what we've been doing at Verily and how we use that information to try to help, especially universities. So the first thing we did in Verily in March was the state of California. Our headquarters is in San Francisco. And so the governor's office in California asked us to help in March, just when COVID was breaking out everywhere. And they said, you know what, we need to figure out how to help people get tested for COVID, because there are a lot of people who are feeling sick or they're worried about having COVID, but it's really difficult for them to get tested. So our company, Verily, which is like a Google company, we're not really a COVID testing company, but we decided that we would do that. So we set up a testing system, and you see how there are these people who are kind of in these paper gowns. Those are some of our employees, and all these people drove up, and we actually had them roll down the window. They were already logged online and everything. And then we actually did the swabs. We stuck the swabs up the nose, which is how you test for COVID. Have any of you had a COVID test?
It hurts.
It hurts, right? Yeah. Well, now actually we don't have to stick it as far back. So hopefully it doesn't hurt as much, because in the beginning they called them almost like a brain biopsy, because it felt like they stuck the swab so far back it was going into your brain. Now they don't have to stick it quite as far, but it might still hurt a little bit. But yeah, I'm sorry it hurt. So that hopefully it hurts less now. But we set these up, and we can actually test. I wish I could actually ask you guys questions more, because it's so much more fun to do that. But you want to know how many we can test with just like one of these vans in this picture here on the upper right? We have these what we call pop-up vans. We can test 1,000 people a day with just one van. So right now we've been putting these testing sites all over the country, and we're testing something like I think maybe 12 or 13,000 people a day. So that's one thing that we're doing. And then if you go to the next slide, another thing that we're doing is we're also working with hospitals to try to help them provide information to their patients about COVID. So we created kind of an app-like program. I don't know if any of you are taking coding, but I really recommend that when you get to the age where you're offering coding in school, or you can do coding in after school, definitely code, because all of these folks that we hire in Google are amazing coders. So in about a week, we put together this tool, which basically helps people go through all the symptoms. And I don't know if it's worth going through that or not. Maybe we should just go to the next slide. Maybe I'll tell you maybe what I think is even more fun, which is a chatbot. Oh, wait, where's my chatbot? Did I not put the chatbot in here? Oh, man. Okay, well, maybe you can click on that link, then the Morehouse Healthcare link. Yeah, see what that does. Does that work?
Yeah, 1 second. Let me just stop sharing and I can reshare it.
So I'll show you what these guys built in 1 week, which is pretty amazing for us. We built a whole app. that helps people go through all their symptoms and then tells them whether they should be worried because they might be sick. So you see this blue, so this is Morehouse Healthcare, it's a hospital system in Atlanta. And if you click this box, COVID symptom checker, this blue view, yeah, click that. This is the app that we built. So all these hospitals all around the country, starting in March, we're getting all of these patients who were calling them up and really worried that they might have COVID. And one hospital told us that the first weekend they had 20 nurses just picking up the phone, nonstop answering calls. And then 1 week later, they had 120 nurses. They had to hire another 100 nurses just to pick up the phone and answer all the calls from people who were calling in scared. So what we did was we built this app so that the patients could just go online, and if you scroll down, what this does, you can click get started. You could just do it for 2 seconds. You could say allow or don't allow, whatever you want to do, it doesn't matter. And it asks you a bunch of questions about, well, maybe, yeah, don't be too ill. Don't say no here. Otherwise they'll send you to the, on this life-threatening symptoms, go down here. Yeah, say none. Down here, say none. Yeah, because if you're really sick, it'll send you to the hospital. So don't do that. Okay, so here you can say no or yes or whatever you want to do. So this app basically asks a whole bunch of questions. Have you been someplace where there is a lot of COVID? Do you have a fever now? I mean, you can say whatever. Do you have some trouble breathing? What else does it ask you? Do you have to catch your breath? I think they're asking you all these questions because you said you're, oh, yeah, actually you made yourself so sick that you have to go to the emergency room. So you guys can try this out on your own. And what it does is though, it sort of gives you guidance about what ought to happen. And the way we built it, which is so cool, is that every hospital needed a tool like this. And so when we started, every hospital was worried about making their own tool, but because we built the tool, everybody could just put this onto their own website, and we just let them stick their own brand on top. So Morehouse School of Medicine, San Joaquin County Hospital, whatever medical group, and they could make it their color so it matches their website, but then they didn't have to do anything else. They could just, it's called dropping a widget onto their website. So we were able to help just tons and tons of hospitals by building this tool. Okay. How much more time do I have? Should I like be wrapping up? Because maybe I just want to show you one more thing. Should I do that?
Yeah, you have time for that. And I think some students might have questions. So you also have time for that after this.
So let me show you the last thing, which is what we've actually built for COVID for universities. And I'm really excited about it. We're actually, so this is about how do we help college campuses start up again. And this big question, everybody's worried about this. And if you go to the next slide, we've actually built a whole program that is so, in my view, so cool. So here's some screenshots from the apps from the phone, or you can do it on your iPad, on your computer, whatever it is. And what it does is it basically lets a university have all the students be able to check in. So on the left, the first one is let's say all the students at USC, let's say hopefully you guys are you're going to do remote learning in the fall, right?
Yeah.
Are you coming back in the spring maybe? Have they decided?
They haven't said anything, but I think they're hopeful.
They're hopeful. So let's hope that in January, Isha will be using this program right here, okay? So what would happen is on the left, if you look at the first screenshot, you'd get an email and you'd click in and you'd join this Healthy at Work program. And you join in and it kind of, it verifies that it's really you. And then you go through those same kind of questions about, are you feeling sick? How are you feeling? And if you're feeling good and everything's good, then it'll go all the way to the very right-hand screen. Pretend your name is Constantine Ramachandran. If your name is Constantine Ramachandran, then if you feel good, then you will have this green check mark. And that basically says you're okay, you're healthy, you can come to campus. Everything's good. If you don't feel very well, or if you're just randomly selected for some testing, because we do that testing just like those orange boxes on the simulation, then we will go ahead and schedule an appointment for you. And so that's this third box that says user tested. And we'll tell you where to go and when to go. You go and get the swab up nose or whatever. And then we'll even send you your results back. Like that's the next step. And we'll tell you if you're sick, you need to stay at home, and we'll give you some guidance. And so this is kind of a big tool that we've built, and we just rolled out this weekend. We're helping a whole state. There are 59 colleges in one particular state. And I can't tell you until tomorrow the state, because we're doing the press release tomorrow, so I'm sorry. But it's a big state and 59 different colleges, and we just started them this weekend. And we, I think, signed up something like almost 6,000 people already. And we're going to do 180,000 students in that state using this program. So if you go to the next slide, this way people can get tested. Oh, and you can go to one more, maybe one more. I don't remember what I have here. Okay, one more. So maybe we just skip this. Let's go to the next one. Go to the next one. Okay, and this is the one last thing, which is, so the university leaders and the professors want to see overall, how is everyone doing? And so they can actually track how all the students in the different classes, or all the professors, or even the staff who are working there, who's eligible to work, who might be sick, how it's been trending over the last few days. And they can even get the specific names and contact information for different groups. So kind of has a whole dashboard. This is what we call a big dashboard for healthy work. And so this is what we've been doing. We've been spending a lot of time in our company trying to help universities get back to campus, and also other kinds of employers, because we need everybody back at work, but also feeling safe. So I think that's pretty much all I was going to talk about on COVID right now. And I'm happy to take a few questions for a few minutes if that would be good.
Yeah, we have a question in the chat right now from Vivian, which is, will they automatically connect you to a physician and or contact tracer if needed?
Ah, that's a great question. So it depends on the university and what they want to do. So in some cases, the university wants us to directly connect them with student health services, like sometimes in your schools you might have a school nurse. So for universities, they have student health services where there are doctors and nurses there. And so sometimes they want us to send the students there. We're really there to help the universities decide what, to do whatever they want to do. And so some of them actually do contact tracing. In other cases, they might do the contact tracing, and the people who are like, let's say I'm sick and I go and they ask me about my contacts. And then what they'll do is they'll give the names of those contacts, and those contacts will come back into our system and say, here are 20 more people who should get tested. And so it'll send you off into that little testing scheduling part of the app, if that makes sense. So it definitely works with contact tracing, definitely does. Is it ethical for, can I read this one? These are great questions. And Vivian, I love the name, great name. Is it ethical for administrators to see students who can and cannot work? That information uses health records, right? Oh, such a fabulous question. What's really interesting right now is that there are some very clear laws and rules about who can see whose health information. So employers, whether they can see, their employees' health information, university leaders, whether they can see students' health information, for example, it depends a lot on the nature of the information. So they're not allowed to see health information, certain kinds of health information. But in this case, the government has basically declared this state of emergency. And so health-related information that has to do with COVID can be shared. everybody has the right to see it. The employer has the right to see it, or the teacher or the university administrator also has the right to see it. And the reason for that is because it falls under basically keeping the work environment or the school environment safe. So it's turned into, it's instead of being you and your medical conditions and is it private, the issue is really more about how do we keep the school and the campus safe. And in order to do that, the safety kind of trumps any issues about privacy because we need to keep everybody safe. So it is allowed. It's allowed.
We had one more question, I think, that was messaged privately to me, but the student was just wondering if maybe the app that's using to track campus health right now, could it be expanded to like a citywide level? Because I guess on a lot of campuses, students are like leaving and entering campus and like interacting with like the community around them. So do you think this app could be applied to like a more large scale community than a university campus?
That is really interesting. So the answer to that is, in theory, yes. But do you want to hear about the complexity of it? Can I just say a word about this?
Yeah.
So I'll just say right now, I feel like all I do is talk about COVID every day. Before COVID, my background has been in healthcare. Like I said, I was the CEO of a hospital system and the dean of a medical school. I just wrote a book. Can I show you my new book, you guys?
Yeah.
So proud of it. Okay, ready? The Long Fix. Woohoo! Now, this book, the answer to that question is kind of what I write about in this book, which is that there's a lot of things about how healthcare is paid for. Like my book is about how it's about fixing healthcare, making our healthcare system work better in the US. And a lot of it is about the business of healthcare, like how healthcare really works, who pays for it, why they pay for this and not that. It's got a lot of stories in it. One of the challenges of everything we're doing with COVID testing, like almost everything in healthcare, is who is paying for the tests. Okay, anybody have any idea how much these COVID tests cost? You guys know? Like to get that thing stuck up all the way up your nose and to get the results. Anybody know?
Can I guess?
Yes? I heard somebody say something, sort of.
$10?
Okay, $10. Good guess. We're hoping eventually it gets to $10. So right now, depending on who you ask and depending on where you go, it's somewhere between, say, $70 to $100 per test. Okay, that's a lot of money, right? $70 to $100 just to have one little swab stick up one nose. So the university.
When I did it, they did 2 swabs.
They did 2 swabs? Well, I think you probably got both swabs for the same price. I don't think you had to pay twice for that.
Okay.
Okay, that's good. So the problem right now with who's paying for it is the universities are paying for the tests. The government has said, and insurance companies have said, that if you don't have any symptoms, if you don't have fever or cough or anything, the insurance companies won't pay for the testing. Even though we know that a lot of people who have COVID don't have any symptoms and they can go around infecting a whole bunch of people. So we really believe that people who are who don't have any symptoms, don't have any fever or whatever, should still get tested. Like on university campuses, we should just randomly pick some people and get them tested. I just wrote a paper, actually just came out today on this in this journal called the Chronicle of Higher Education. So people really should get tested, but there's no one to pay for it. So at universities, the universities are paying for these tests. If you wanted to broaden it to a whole city, you'd have to figure out who would pay for it. So if the city said, oh yeah, we'll pay for it, okay, that would be fantastic. That would really work. But right now, there's no city that's organized enough to actually pay for testing for a whole community, if you know what I mean. And that's really a problem right now in the country, figuring out how to get enough testing to enough people so that we can keep all those blue triangles from turning into red dots. That's the biggest problem that we face right now.
One of the other questions that a student messaged was, a couple of weeks ago we had Dr. Zisman from MIT talk about a contact tracing app that he was working on developing. And one of the issues he mentioned is that you need around 60% of the population to be able to kind of enroll or kind of have this app on their phone for it to be successful. So the student was wondering, kind of, are there any similar challenges with the things that Verily is creating that they need to overcome?
Right. So, very early on in COVID, Google and Apple partnered, which is really great. So Google and Apple announced that we were going to work together to create a contact tracing program. And it's basically, you don't even need to report anything. It's just when my phone comes in contact with your phone, like you're close enough, our phones just know that we were close to each other. Right? So it's all the contact tracing, and it's very similar to what the MIT team has built also. There are a number of these contact tracing apps that they're different. They're not all the same, but they use some of the same technology. And I think what's tricky about some of those contact tracing apps is that there's maybe 2 or 3 issues. One is you need a lot of people using it, like you said, 60%. If only a few people are using it and everyone else's phone isn't receiving or sending, then you're really not going to be able to tell who's doing contact tracing. And a lot of people who, when they've done these national surveys, have said they don't feel comfortable having everyone know where they are and the contact tracing. So we have kind of a fundamental problem in this country, which is there's, you know, on the one hand, like in some countries, the government just mandates it. In Singapore, they mandated it. In Korea, they mandated it. You know, in a lot of countries where they've mandated it, contact tracing has been very effective. In this country, we don't mandate it. And so, because we value more the freedom and we don't want to constrain people and constrain their freedom. So just having half the people do it, it's just not really going to work. So most of the contact tracing still now, it just relies on reporting people talking about who they've seen. The other challenge, of course, just because you've been close to someone doesn't necessarily mean, or your phone has been close to someone, doesn't mean that you've actually been, like if you left your phone on a charger somewhere and other people, you know, came by or whatever. So it's not a perfect way of contact tracing either, but that's still, you know, that's kind of a more minor problem. The main problem is most people probably won't do it. And as you discussed probably in the vaccine part, that's a big worry of all of us who are thinking about vaccines is, you know, the surveys are saying maybe 70% of people will get a vaccine. And a lot of people are right now saying that they don't want to have a vaccine, just like they don't want to wear a mask. And that would be really unfortunate because those people can give COVID to everyone else. So, you know, it's not so much about if they don't want to have a vaccine, it's more that they are endangering everyone else. So these are some of the concerns I think we have and why we need to kind of each do our own part, you know, each do our own part. Everybody should wear their masks when you go outside and interact with other people and really just follow all those rules about social distancing and washing your hands. It's really important.
I had a quick question just about schools and universities in general. So I know since Verily is working with a lot of college campuses, I was just wondering, what are your thoughts on like the general trend across the United States right now about schools reopening? Or what do you think is like the best model for schools to follow in the fall?
You mean universities or you mean high school?
Universities would be more relevant to Isha and me, but I think most of these students are in elementary or middle school. So is there anything done at that level?
Yeah. Now? So I think it's really very hotly debated right now. I mean, I think that, in fact, I just, you know, was on a video conference with 2 people who I think a lot of, they're really experts in public health, and they literally took completely opposite views. You know, one much more conservative saying, you know, we really should keep kids at home, et cetera. And the other one was saying we need to get everybody back to school. I think there's so many issues that are very difficult to untangle because having kids, the cost, what you're asking for kids, for you guys, is how much worse is your education? Like, so how do you trade off health against education? And then there's finally the issue of your parents being able to work, right? So many of my colleagues at Alphabet and at Google have young kids. My kids are in high school, so if they're working at home, if they're doing school at home versus at school, it's probably not such a big deal. But the younger you are, the harder it is. And I think that I don't think that kids learn very much. You know, they didn't do as well with remote learning in the spring when we did it. I don't know how you guys feel about it. I'm curious, like how many of you felt like you learned as much from school when you were at home in March, April, and May compared to what you think it normally would have been? Just raise your hand if you think you learned about the same amount. Okay, and then put a thumbs down if you think you learned less. Okay, and then put a thumbs up if you think you learned more. Anybody think they learned more? No. So I think that's basically the trade-off, right? It's more of an opinion than a clear set of answers. If we actually could do, we could actually, put in enough precautions and do really lots of testing. If we could do a lot of testing, like let's imagine a magical world where you could actually test everyone every day. Like let's say you just spit in a tube when you came in, right? And it cost pennies to run this test. Then everyone should just go to school, because then you could just test and you'd know within 10 minutes and you'd say, oops, out of here, don't stay, don't get anyone else sick. But we haven't gotten there yet. And so now I think it's just this, debate about it. So, and I don't know if I can really weigh in. I can weigh in on universities. Like I said, I just wrote a piece that came out this afternoon, and my recommendations were that for universities, everyone should get tested before they really engage back in campus. So either when they're still at home before they come back, or right when they get back to campus, they should get tested, like everybody, because there's so many parts of the country that are really hot now that have a lot of infection. And then I also recommend that 1 week after they arrive at campus, they should get tested again, because just in the course of coming back to campus, especially if they're traveling, they might get infected. So they should have 2 tests, like pretty much 1 week apart. And then we should test everybody who is feeling sick, of course. And then we should do some random sampling of people who don't feel sick. And I think that that's a pretty safe way to go for universities. And I skipped some of those slides, but we've done some really nice modeling that shows that we can probably keep COVID contained on universities. So I'm really hoping that USC, for example, in the spring, will be able to do something like that. And hopefully our experiences in the fall will prove that that's the case, hopefully.
Yeah, fingers crossed. Hagios, I know you have your hand raised. Do you want to ask a question aloud? But not sure if that was also just having your hand raised when Dr. Lee asked a question.
Sorry.
Oh, no, you're totally good. Another student asked me a question that I think was pretty cool in terms of what does Verily do other than just COVID stuff? So like before COVID, what are some of the other projects that they've been doing?
Okay, my favorite topic, yeah, because I really like talking about COVID all the time, because we do a ton of other things. So I'll tell you one thing that we do, and then this might be my last answer, because my kids have made dinner for me, so I kind of want to go eat. So one of the things, we do a whole bunch of different things, like we do a ton of different things. Okay, I'll tell you 2 things that we do, okay? One thing is really easy, but actually you guys as kids may not even appreciate this, okay, do you guys have parents who need bifocals, or do you have grandparents who, like when they're reading, they read and then sometimes they go like this to read books because they can't see that well? Do you know what I'm talking about?
Yeah.
Okay, bifocals, right? So we actually have made, and we're still developing it now, contact lenses where you put in the contact lens and you can see far away, and then you blink a couple times and you can see up close. And then you blink again and you can see far away again. That's pretty cool, right?
Yeah.
If you see the contact lens, it's really cool. Like if anybody wants to be an engineer, say it again. If anybody wants to be an engineer, you have to check out this kind of stuff. Okay. The other thing, one area that my team works on a ton is for people who have diabetes. You guys, anybody know anybody who has diabetes? All right, only the college kids know. Okay, do you guys even know what diabetes is? It's a disease.
I think we have some yeses in the chat.
Oh, we have some yes in the chat. Okay, great. I'm so happy to hear. So basically you can't, what happens is when you eat food, your blood sugar, the amount of sugar in your blood goes way too high if you have diabetes. And so then you need to take insulin. And when you take insulin, it'll kind of get your blood sugar down. You get an insulin shot or you take some medication. So there are a lot of people with diabetes. And our project
My parents have diabetes.
Say it again? Who has
My parents have my parents.
Your parents do? Okay, so when people have diabetes, depending on the kind they have, sometimes they actually prick their finger to check their blood sugar. So they prick their finger, they get a drop of blood, they put it on a little strip and they stick it in this little machine, and that tells them how high their blood sugar is.
I've seen that in a movie.
So what we did was we built this little device. It's about this big and it's a continuous glucose monitor. And what that means is instead of pricking your finger, you put this thing on your arm, or you can stick it on your belly, and it lasts for a couple weeks. And basically it measures your blood sugar continuously all the time. And it sends that information to your app. And on your app, you can look at your blood sugars go up and down every time you eat food or you exercise or whatever you do. And a lot of times it's actually not only for diabetes, it's also for people who want to lose weight. Actually, people lose a lot of weight with this program too. So you can see your blood sugars, and then normally for diabetics, we ask people to keep a log of the food that they eat. So they're supposed to keep a journal and write down what I ate for breakfast, what snacks I ate, blah, blah. Nobody ever does that. Like in a doctor's office, nobody ever fills out those things, but we always ask them to do it. But instead with our app, you take pictures of your meals and snacks, take pictures of your bowl of cereal or a picture of your hamburger or whatever it is, and it automatically recognizes those meals and snacks using artificial intelligence. And so if you're a patient for the first time, you can actually see, oh, here's what I ate and here's what it did to my blood sugars. And we also use some artificial intelligence to make recommendations like, okay, Vivian, you want to eat a chocolate brownie again. The last 3 times you ate a chocolate brownie, this is what it did to your blood sugar. Like it went way, way high. So maybe you shouldn't do that. Or we notice when you have soy milk in your cereal compared to when you have regular milk in your cereal, your blood sugar does much better, you know? So it's a whole program for helping people with diabetes or who are overweight. And now we're doing high blood pressure too, to help them stay healthy. It also, you can do video conferencing, you can chat with a doctor, you can, video on your phone with a nurse or a coach. It's really fun. It's called On Duo. So that's one of the things we do. That's an example. Okay, I think I might have to wrap now.
Well, thank you so much, Dr. Lee. I know the students learned a lot. Can everyone give her a big thank you?
Thank you.
Guys.
Thank you so much.
Well, keep up the great work.
Here.
You did. Thank you for saying that.
Thank
All
you,
right.
Dr. Yu.
All right, you guys keep well. Be nice to Isha and Ryan because they're going out of their way to teach you stuff. So that's really nice of them. All right, bye guys.
Bye.
So just out of curiosity, I know we didn't have as much time to answer kind of things about the vaccine and the development because we wanted to give Dr. Lee her time. Does anyone have any other questions about that, or any questions about Dr. Lee's work, anything that you want us to kind of recap or send the links to the chat? We would love to do that before we kind of say goodbye for the day. Okay, perfect. I guess if no one has any questions, oh, Krishna, I don't know if you have your hand raised. Do you have a question?
Yeah.
Yeah,
Wait,
sure.
are there like any other she mentioned about since I was only here at 4 o'clock because I had a class.
Mm-hmm.
So she mentioned about the testing, like how much it costs.
Mhm.
Like for any other diseases, do you have to test, and like how much are those costs in comparison?
That's a great question. I think we can definitely look into it and let you know more about it. But you definitely do have to get tested for I mean, testing is the main way that doctors can see whether or not you have specific diseases, but I'm not entirely sure what the cost is. I think Ryan, by the look of his face, is searching some up right now, so he might be able to tell you in a second.
So, I just did like a quick search. So the longer a disease has been around, the cheaper the test has been. So I just searched up a really quick article right now, and it says right now a COVID-19 test could be several $100s depending on where you get it tested from. And that's obviously a lot of money, and not everyone can afford that. But for example, for HIV, which has been around for quite a long time, and like public health officials and scientists kind of understand how HIV works, to get tested for that virus, it costs about $40. So I think
On the coronavirus.
Huh?
Like, because I know Corona is gonna be the most expensive. Like, which is the most expensive other than Corona?
Oh, like, I guess the rarer the disease, or like the newer the disease, the less we know about a disease, I would assume the more expensive the test. Like testing for whooping cough probably is not that expensive, but if you want to test for a very rare disease, then you would probably need a lot more money or resources to put together a test like that.
Okay.
And I know Akshara also mentioned the fact that during the preclinical phase, we have the fact that before we're even allowed to test on humans, we need to test on animals. So she was wondering kind of why aren't there any regulations about that? And I think that's a really good point. And there's a lot of like animal rights groups that are protesting that, saying that there should be a way to test vaccines without having to put animals through that. I found a link from the FDA that kind of explains why they need to test on animals. So Akshara, if you're curious, you could always kind of look more into that. But you're definitely right. There's a lot of people, a lot of groups out there who have said that they shouldn't, that we shouldn't need to have to test on animals. So that's a really good point that you bring up.
I have a question.
Mm-hmm.
My question is, let's say you have a pet and you have the coronavirus. Is it possible for you to spread the coronavirus to your pet?
Yeah.
That's a really good question. I know that our first two guest speakers, Dr. Medivada and Dr. Maldonado, talked about how dogs can actually test positive for the coronavirus. So it could be possible that if your pet is a dog, like you could spread it. I know.
Tested positive too.
Oh, sorry. What did you say, Ryan?
I said cats have tested positive too. So, but they don't know if dogs can give it to humans. Like, yeah, and a tiger tested positive too in New York.
Didn't like I forgot which guest, but one of the guests said that like we have SARS-CoV-2, like our virus. Like she said, like there are many coronaviruses, and like different animals get them. So like how like following up to Nuja's question, how do we mix like how can you mix the viruses together? Like I don't like, can you actually give like a dog your virus because like they don't get the same virus as you?
That's a really good question, Krishna. And Ryan, I think you would be perfect to answer this. We talked about this a couple weeks ago in terms of how like the viruses is able to jump from one species to another by mutating. And that's kind of how it would be able to.
And yeah, also, I don't think dogs and cats show like the same symptoms as humans do. So for now, it's okay to be with your pets if you guys have dogs and cats at home. A lot of dogs and cats have tested positive and they've been just fine, and they didn't spread it to any other humans. So as of now, I think it's pretty safe to be with your pets, and we should be more worried about other humans. But that was a good question and a good tie back to week 2.
Yeah. Does anyone have any other questions? These are some great questions. And again, I know I like sent this in the chat earlier, but I would definitely recommend you guys to look at that vaccine tracker because it's super, super cool how they're like compiling all of that information. But yeah, with that, thank you all for joining us today. You all had some amazing questions, and we're super excited to see you guys next week where we're going to be talking about climate change and the coronavirus, because not a lot of people are talking about how global warming in the environment is impacted by a pandemic as well. So that's going to be really cool, and we're super excited to see everyone next week. Take care in the meantime.
Stay safe. Bye.